Hello, podcast listeners. Welcome to today's CAHL podcast. The California Association of Healthcare Leaders, otherwise known as CAHL, is an independent chapter for the Northern and Central California region, chartered by the American College of Healthcare Executives, or ACHE. CAHL serves healthcare executives in 50 of California's 58 counties. Our vision is to be the premier professional society for healthcare leaders in our region, advancing healthcare excellence and healthcare leadership, and improving the lives of the communities we serve. These podcast episodes are meant to provide thought leadership on numerous healthcare topics from our CAHL members and their allies. Today, we welcome Julie Marston, who is an accomplished nurse executive with over 2 decades of experience leading inpatient and outpatient hospital-based services, process development, and delivery of patient-centered, high-quality care in academic and non-academic settings. She's been a CAHL member since 2020 and lives in Dorado County. She's the CEO and principal consultant at Marston Yoder Healthcare Consultants, collaborating with healthcare organizations across the nation to advance healthcare equity through a population-based approach to chronic disease management. Specifically focused on the heart failure patient population, she and her team design and implement customized, comprehensive, cross-continuum programs to implement best practices and guideline-directed therapies, close care gaps, and optimize transitional and outpatient management for organizations who endeavor to provide optimal health in their communities. For those that know Julie, she has a reputation of putting the patient first and continues to keep a patient-centered approach as the guiding principle in her work. She's passionate in her pursuit to improve the quality of healthcare delivery systems across the care continuum, believing wholeheartedly that when patients thrive, organizations thrive, communities thrive. Welcome, Julie.
Thank you, Michael, very much for having me today.
So, Julie, you have a very comprehensive background, and as we talk about the theme today of authentic leadership, what does it mean when we say being an authentic leader, and how do you define that for yourself in terms of the work that you've done over the last 2 decades?
Well, really, I channel my inner Brene Brown. She has done a lot of work in authenticity and vulnerability, and I really like her definition of authenticity as a daily practice of letting go who we think we're supposed to be and embracing who we really are. Being my authentic self is really a daily choice, really a moment-to-moment choice. And that is true for me personally and professionally. And for me, my professional self is an extension of my personal self.
So why don't it's interesting that you mentioned Brene Brown. My daughter just went to her cousin's surprise birthday party, and her cousin's is a friend of Brene Brown in Texas. And
Wow.
so when she had mentioned her, she didn't get to meet her because she and her family were on vacation, so they didn't come to the surprise birthday party. But it reminded me again about that we have a living inspirational leader that's provided some thought leadership in that area. So why don't you tell us a little bit about Brene Brown for those that may not be familiar with that individual and what she espouses to?
Brene Brown, for me, I think I came across her on a podcast actually, but she's essentially a person who has spent her entire career researching vulnerability, I believe is how she started, and she's really expanded her work over decades and has touched on vulnerability and authenticity and being brave and really, I think, a lot of facets of the human experience that get to the heart of who we are as people, and then how does that manifest in the world. And she has done a lot of work, I know, with organizations and really bringing that awareness and approach to the professional world as well. It really does, in my opinion, marry over to healthcare really, really well. I believe, do our best work for patients when we're authentic caregivers. And so Brene Brown's work has been really interesting to follow along the years. She's written a lot of books and she's really, I think, in today's world.
So, Julie, share with me a personal experience where you were able to bring your authentic self to the work that you do.
I would, well, there's lots every day, but I think in the beginning, when I really started exploring authenticity, I think when I understood the impact of authentic leadership was probably when I was relatively new in a role as a director of many departments, and so I brought these departments together. I was really enthusiastic about process improvement, and as I was newer in the role, and I was sharing my ideas, and I realized one day that no one was as enthusiastic about them as I was. and so
Mhm.
and so I did not understand that. I was a little bit frustrated, but also confused a little, because I thought it's great things to share. And I brought someone in the office, employees, and I said to her, I really feel like people aren't embracing this and aren't responding to it the way I imagined they would. And can you give me some insight into that? And she looked at me a little bit sideways. And I realized in that moment that I was asking her to be really vulnerable and share something that a boss might not want to hear. And so I recognized very quickly that she needed to feel safe to do that. And so I really let go of what in my brain is the boss hat. And I just said to her, I need to know from like the deepest, truest place in my heart why I'm not getting a connection with people in these things that I think are truly good ideas and I want to. Can you help me understand? And she did. She bravely shared the open truth that was not favorable about, much of what I was wanting to be favorable. And it really sat with me that if I wanted to do a job as a leader, if I wanted to have positive impact, I had to create a space where I was authentic and people could be authentic. And because for me, when people feel safe, then they do great work. And in patient care, that's all that matters, is doing great work for patients and creating a safe environment. I think that's kind of the first experience I had with the importance of authenticity in my role as a leader of other people who I want to be doing great work.
Julie, that really speaks to me. I know that as a leader, I've had the opportunity when I'm meeting people for the first time to bring them together, just as you've talked about. And one of the things I do is I start the meeting with let's do a round robin or a round table, and you share something that's working well. And because people don't have that sense of trust yet.
Mhm.
And I said, and if we're not going to interrupt, we're going to listen, and you can pass if you want. That there are a couple of people that chose to pass because
Mhm.
they just didn't want to share. And again, it's something that's working well. And after they saw that everyone rounded and shared some phenomenal things that they didn't know what was going on, they said, "Oh, can I share something now that's working well?" Because it was again developing that safe space that they realized that they weren't going to get in trouble for speaking the truth. And
Mhm.
so as you shared this example or this story, um, what strategies do you employ to support that authenticity while navigating the complexities of healthcare management? Because again, especially as a consultant, there's a lot of changes going on, and a lot of times they bring you into the organization when there's either a crisis or things that need to be solved. And how do you bring that authenticity to these situations?
Yeah, I from that kind of early lesson, I really did begin my conversations or my process improvement ideas with, I have an idea. I would love to share it with you if you have the time, because that's important. And then I'd say, I do really want to hear your honest feedback, your thoughts, your ideas. If they're different than mine, that's great. That's how better ideas are made. And so I try to begin those conversations about change with an open invitation to please disagree with me, bring all of your ideas. I think that, that is an approach that I have continued, and when I approach challenges, or if there's, an organization is having an obstacle and they want a solution, I do begin with conversation with all of the people involved, in any way, shape, or form, possibly involved with this problem or issue. And I ask very open-ended questions. Same thing. I'm just trying to gain information, gather their perspective in a very non-judgmental and supportive manner. I think that's really, really important. And then when something doesn't make sense to me, or if I disagree with, a decision or initiative or something, I ask a lot of questions to seek better understanding. I genuinely believe that everyone is in healthcare to do good work. No, I don't think anyone's come to this field to not take good care of patients or not be a part of taking great care of patients. So I come with that belief that everyone is there for a good reason. And if something doesn't make sense, I ask and I seek, and I'm very honest about it. I'm struggling. Can you help me? I really want to support this. Help me get there. Here's some questions I have. And that's worked for me in leadership, in consulting, and in life. I feel like that builds trust, which to me is a foundation for authentic relating.
What you that community does play important authentic leadership within healthcare, that you're showing your vulnerability, and you're hoping that others, by seeing that, will be vulnerable as well. So how do you build that trust, so that, because again, especially in consulting, you're coming in, there's a problem, they may be afraid that they're going to be fired or laid off, or they're going to be criticized for something they're doing or not doing, and so how do you build that trust and that vulnerability in being an authentic leader?
I think the open listening, reflective questions also, when I summarize at the end of a conversation, if it's, for example, an exploratory conversation, and I'm asking for information, when they provide it, I ask if I've understood them correctly. I'm telling them that I am hearing them and that I'm listening, and I use a lot of follow-up questions because I really genuinely want to have a good understanding of their perspective. I think I've been fortunate enough in my consulting roles that the people I speak to share the sense that there is something that could be better with the given situation or project. And so I usually do open with, what about this works well for you? What about this doesn't work well for you? And I love saying, if you had a magic wand and you could wave it and make it different, what would that look like for you? And people really have responded positively to that, because someone's asking them for their unique perspective. I'm not telling people what I think is the right answer. I am asking them what they feel is good, is not so good, and what they might do differently if they could. And that really does seem to open people up to share.
I love that magic wand analogy. When I meet with individuals, I'll say something such as, if you could only change one thing, what would it be? And it really helps them to prioritize that. And it's very much of that magic wand. If you could have a magic wand, one wish, what would it be?
Yeah.
For you to be able to do that? So that's a really nice way to be able to do that.
And
so
then,
yeah, go ahead.
Well, and then it's been really rewarding to see that in pretty much every situation, every player on a team, despite the fact that oftentimes they're so disconnected from one another, when they look at a situation, they almost always have the same perspective and goal. Their goal is the same, and so their solutions are often very similar. I think we have had the opportunity to work with some really great organizations where everyone is philosophically aligned, and so they're and are really prioritize doing great work. And so it's been really actually restorative for me as a person working in healthcare to see other teams that are so inspiring and collaborative and really positive minded. So that approach has actually probably given me more of a gift than anything else. So it's been nice to see the way people do come together, and everyone does really see situations in the same way, if not from a different perspective. It's like lineup, right? Everyone sees something a little bit different, but it does create a whole picture. So it's been a really rewarding experience.
With you being a consultant, you've worked with a lot of different organizations, and this gives you a chance to maintain the confidentiality of the organizations that you've worked for, that you've gone into organizations where there may have not been authentic leadership, where there may have not been a culture of trust, where there may have not been what does that result in when you've gone into organizations and you've seen that there's not authentic leadership? And is it possible to be able to work with those individuals or those organizations to be able to pivot so that they can become more authentic and more effective in the outcomes that they're trying to achieve?
That is a tricky one.
Yeah.
In many different roles, I've seen this perspectives. And I think I really don't think there's one size fits all answer to that.
Yeah.
In my experience, if there's a lack of authenticity in leadership, I would say sometimes it can be a genuine lack of authenticity. It can also be a perceived lack of authenticity. It can be a failure of leadership to adequately articulate, communicate their perspective to others. And all of these things are things that I have seen, and very rarely have I seen people just be terrible leaders. That's thankfully not common. There's people who are not as skilled in leadership. There are people who have struggles and prevent them from being authentic leaders for one reason or another. I really do look at each instance as an individual instance. Staff the same way. When things get in people's way, I really genuinely ask a lot of questions, try to seek understanding. If I'm not in a position in an organization that I can change a culture or leadership, there's a saying, be the leader you want to see in others. And so I do conduct myself in a way as a leader that is as I wish others would also conduct themselves in leadership. And sometimes that's enough. Sometimes you can work for somebody who is not demonstrating leadership in a way that is in alignment with my personal values, and that is not an obstacle that cannot be, it's not an obstacle that can't be overcome. It is just a aspect of the situation. And for organizations, culture is a tricky one. Changing an entire organization's culture is not an overnight process. And I think that, again, most of the time, people have really good visions for positive outcomes for an organization. And sometimes, unfortunately, you just can't get there. And if an organization is not a good fit for me as a consultant, I don't take the work. If an organization is not a good fit for me as an employee, I look for another opportunity, either within the organization or outside the organization if necessary. To me, it's really foundational fundamental for me that I work with people that I respect and feel are doing what they can to make a great patient care environment. And so sometimes it's not a good fit, and that's okay.
I found, Julie, that in working with an individual, a department, or a organization, that sometimes the organization isn't ready for the change that they
Mhm.
say they are. And then when you share with them some of the things that they're going to need to do in order to get there, they'll come back and say, I appreciate you providing this perspective or this insight. We're not ready for that. Doesn't mean that they're inauthentic. It just
Mhm.
means that they're at least acknowledging that they're not ready for whatever change that, well, I want to be like this organization or that organization. Okay. And these are some of the things that you're going to need to do to be able to get there. Oh, we're not ready for that. They want the outcome, but they don't want the work
Yeah.
that's going to be required for that.
Yeah,
So,
and yes, if they don't have all the resources they need at the time to make it happen, it wouldn't be the right time to do it anyway. So there's people are complex and organizations are many people.
So Julie, can you share an example of a challenging situation where authenticity played a crucial role in your decision making as a healthcare leader?
Yes, I had just accepted a leadership role that was an elevated level for me. It was a step up. At the time, I really felt like my track was to escalate in leadership. And in my mind at that time, that was success. And so I had achieved my next step on that ladder. And shortly after, and I really pursued this role. I wasn't, I wasn't supposed to be the person in the role, but I went after it and I really got it and I made it mine. And shortly thereafter, a leader from a different part of the organization came to me and asked me to come work for them with the intent that they would, I would be their mentee and then they would eventually retire. And I said, I can't do that. I've just taken this position that that I want to be honest and have integrity and do a good job with it. And so I declined the offer. And a year later, that person came back to me and said, how do you feel about it now? And I wasn't sure if I should answer that honestly. And they said, I really want you to come work under me. I want to mentor you. You're the kind of person that I want to lead my department. And I feel confident that this role isn't the role that it could be or that you want it to be. And they were being very polite, obviously. And I was working for a leader that was not authentic in the way I wanted to be led. And this person who had approached me was the most authentic leader I had ever met in my career. And I felt like I was doing a bad thing to leave a role after a year. And I knew that I had an opportunity to go be mentored by someone who could really teach me how to be the leader I wanted to be. And so I did. I did go work under this person, and it was foundational in my leadership journey.
I can appreciate that. When we make a commitment, what's the commitment that we make? And
Mhm.
do we stay true to that? And especially in today's environment where people will not even give a second thought to be able to jump from one job to another because of either pay or a title or something else, that it's critically important to be able to be true to yourself as well as true to what you value, and to lead by example. So Julie, I'd like to finish up by so moving forward, how do you stay true to to that authentic leadership style, especially in consulting? Because you aren't just working for one organization, you're working with many different organizations. And how do you let the organization know what is authentic leadership self, so that, as you had indicated, you just will not choose to take the engagement as a result.
Yeah, I think I lead with authenticity and total transparency and what we have to offer clients and what would that look like, and very upfront from the start. I do seek out organizations that have mission statements, value statements that are in alignment with my values, and I have spent quite a bit of time in those exploratory conversations to make sure that we're in alignment and to see if we are. And most of the time, yes, authentic leadership is who is reaching out for help in the organization. I find that I really haven't found anyone reaching out that isn't doing so to make a positive change in the organization. And so we've been lucky, I think, in finding really, like I said earlier, inspiring clients that have really reinvigorated my enthusiasm for healthcare and for doing great work. And
So Julie, any final thoughts before we conclude our podcast for our listeners today?
I think just what you've said already, being an authentic person, authenticity is who we are, and if we carry that into our work, it benefits not just ourselves, but also healthcare. This is a very difficult profession and business, and at times can really feel like it's not treating everyone well. I mean, honestly, there's a lot in the news right now with healthcare and how people feel about it, and some of the less flattering aspects. And I genuinely believe that if we have authentic leadership, we have people who want to lead organizations to good places and treat people well. And for me, it really is all about the patient. And if everyone is feeling respected and valued at work, then they are taking amazing care of patients. And for me, that's what it's really all about.
Thank you, Julie. This concludes CAHL's podcast for today. We hope you've enjoyed this event, and we have plans to continue providing thought-provoking insight from healthcare leaders throughout CAHL's geography. We hope you learn something new every day, that you have an opportunity to make a difference, and that you're kind in doing so. Thank you, everyone.
Thank you, Michael.